Introduction. Welcome, students, to today's lecture on the histology of the female reproductive system. In this comprehensive script, we will explore the intricate anatomy, physiological processes, and histological changes that occur throughout a woman's reproductive lifespan. Understanding these topics is crucial for medical professionals, as it enables them to diagnose and manage a range of reproductive health conditions. Without further ado, let us delve into the fascinating world of histology and the female reproductive system. The female reproductive system consists of ovaries, fallopian tubes, uterus, and external genitalia. The ovaries contain follicles that house oocytes, which mature into eggs. The fallopian tubes transport ovulated eggs to the uterus. The uterus is where the embryo and fetus develop. The external genitalia protect and contribute to sexual pleasure. Oogenesis is the process of egg development, starting before birth and continuing throughout a woman's reproductive life. Ovulation occurs when a mature egg is released, triggered by luteinizing hormone, LH. If fertilization occurs, the egg completes meiosis and forms an ovum. The sperm and egg fuse to form a zygote. The menstrual cycle consists of 4 phases: menstrual, proliferative, secretory, and ischemic. Each phase is regulated by different hormones and involves specific changes in the endometrium. These changes prepare the uterus for potential implantation and, if not fertilized, result in menstrual bleeding and the start of a new cycle. During the menstrual cycle, the endometrium goes through different histological changes. These changes are influenced by estrogen and progesterone levels. The menstrual phase involves shedding of the functional layer with fragmented glands and debris. The proliferative phase sees regeneration with elongated glands and vascular stroma. The secretory phase involves coiled glands with abundant glycogen and increased vascularity. If fertilization doesn't occur, the endometrium enters the ischemic phase with degenerated glands and compact stromal cells. Understanding these changes helps us understand the role of the endometrium in reproduction. 5. Role and histology of the cervix and vagina. The cervix and vagina are integral components of the female reproductive system, each with unique anatomical and histological features. The cervix functions as a barrier between the vaginal canal and the uterine cavity. It also plays a critical role in sperm transport, lubrication, and the production of fertile cervical mucus. Histologically, the cervix contains numerous mucus-producing glands, which secrete alkaline mucus under the influence of estrogen. The vaginal canal, or birth canal, provides a passageway for sexual intercourse, menstruation, childbirth, and the delivery of a baby. Its histological features include stratified squamous epithelium, which provides protection against microbial invasion and mechanical stress. Throughout a woman's life, the cervix and vagina undergo physiological changes, particularly during menopause. This leads us to our next topic, the physiological changes experienced during menopause. During menopause, the ovaries undergo involution with decreased follicles and hormonal secretion. The endometrium becomes atrophic, the cervical and vaginal epithelium thins, resulting in symptoms like vaginal dryness, hot flashes, and mood swings. Understanding these changes is important for managing symptoms and providing health care to women. There are various methods of contraception available, each with different mechanisms of action. Hormonal methods suppress ovulation and alter cervical mucus. Barrier methods physically obstruct sperm entry. Intrauterine devices create an uninhabitable uterine environment, and sterilization blocks the fallopian tubes to prevent pregnancy. Healthcare providers need to understand these mechanisms to provide accurate counseling. Infertility is a common issue that requires in-depth understanding and investigation. In females, factors like ovulatory disorders, structural abnormalities, endocrine disorders, and infections can contribute to infertility. Evaluations involve hormonal assessments, imaging studies, and specialized tests to determine the underlying causes. In this section, we will explore the histopathology and diagnostic approaches for reproductive cancers. Cervical cancer is commonly caused by high-risk HPV, and histopathological examination is crucial for early detection. Endometrial cancer can be identified through endometrial biopsy and histological examination. Ovarian cancer requires histopathological assessment, immunohistochemical profiling, and genetic testing for accurate diagnosis and prognosis. Breast cancer, though not exclusive to the reproductive system, involves histopathological examination and molecular profiling for effective treatment and prognosis. Understanding these approaches is essential for delivering optimal care to patients. Immunological aspects are crucial for reproductive health and successful fertilization, implantation, and pregnancy. Immune cells in the female reproductive tract defend against pathogens and tolerate sperm and embryos. Immunoglobulins in mucus and secretions protect against infections. Immune balance is important during pregnancy to tolerate the fetus while fighting infections. Understanding these processes helps with infertility and pregnancy complications. Next, we will discuss advancements in infertility treatment, like assisted reproductive technologies, ART. Assisted reproductive technologies, ART, have revolutionized infertility treatment. In vitro fertilization, IVF, is a common technique, while intracytoplasmic sperm injection, ICSI, is used when sperm quality is low. Embryo cryopreservation allows for the storage of embryos, and pre-implantation genetic testing, PGT, screens for genetic abnormalities. Ethical, social, and legal considerations surround ART. Assisted reproductive technologies, ART, have revolutionized reproductive medicine. Ovarian stimulation increases the number of mature eggs available. Oocyte retrieval collects mature eggs for examination. In vitro fertilization creates embryos, which are evaluated for viability. Embryo transfer requires proper placement for successful implantation. Understanding the histological aspects of ART enhances our knowledge of these procedures and their effects on reproductive histology. In conclusion, understanding the intricate histology of the female reproductive system is vital for diagnosing and treating reproductive conditions. We have covered a range of topics, including anatomy, hormonal regulation, infertility, and reproductive cancers, providing a comprehensive understanding of this complex system.